and we say welcome this afternoon to the media who are in attendance. And just a quick reminder, if you'd like to submit a question, you can do so using the question form here on Microsoft Teams. Just click on the text bubble with the question mark. And when you submit your question, if you could please indicate your name, your media outlet, and who your question is for. We're very happy to be joined this afternoon by the Mayor of London, Ed Holder, by the Chief Medical Officer at the London Health Sciences Centre, Dr. Adam Dukelow, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. And welcome to you tuning in as well, whether you're watching us on Rogers or the Rogers Facebook page or YouTube channel, listeners to Global News Radio, AM 980 CFPL, and those who are watching on the CTV London website. Let's begin with the opening remarks right away, and we'll start with Mayor Ed Holder.
Well, thank you, Dan, and good afternoon, everyone. And a sincere happy start to our spring season. It's my hope with the relatively mild temperatures in this forecast that everyone takes advantage of some outdoor exercise and recreation. You know, even in the absence of a pandemic, it's good for you. And we all know any outdoor activity, especially when physically distanced, is an ideal way to limit the risk of COVID. There certainly was little in the way of physical distancing, though, and wearing of masks at a demonstration over the weekend in Victoria Park. I understand those in attendance were protesting lockdowns, which I find bizarre, as no businesses in London were locked down. This is nothing less than irresponsible actions from irresponsible people. We should all be exceptionally disappointed by what took place at Victoria Park. Look, we all understand the frustrations associated with lockdowns, but this kind of ridiculous behavior is the kind of thing that causes our numbers to go back up. And I am incensed, and all Londoners should equally be angry. We know there were many individuals who attended who were not from London. We also know the event was monitored by our City of London bylaw enforcement and the London Police Service. At this point, I don't have anything to report with respect to charges or fines. But having said that, I'm advised that the investigation is ongoing, the file remains open and active, and I look forward to fines and charges coming as a result to make the point that this is inappropriate and wrong. We'll certainly provide that information to you. Now, on a separate topic and on a positive note, I'd like to publicly acknowledge and thank the greatest majority of Londoners, including students from Fanshawe and Western, who helped us keep St. Patrick's Day a relatively quiet affair this past week. That to me was extremely encouraging and also to me not surprising, because Londoners get it. And they've gotten it from the start. It's why we continue to have among the lowest case counts of any medium to large size city in Ontario, and why I expect we'll carry on that way, even as the vaccination campaign ramps up. Lastly, I'd like to acknowledge London West MP Kate Young. She has just announced she would not seek re-election when the next federal campaign occurs. London West and our city have been fortunate to enjoy the strong representation provided by Kate during her time in Ottawa, and her support for London during this COVID crisis has been exceptionally significant and truly matters. I know all Londoners join me in thanking her for her tremendous community service. And with that, over to you, Dr. Mackie.
Thank you very much, Mr. Mayor. So our local case counts continue to slowly increase according to our 7-day moving average. Our provincial case counts as well are on quite an upward slope. From the provincial level, this looks very much like late November, just before we had the late December peaks that continued on into January. So the only difference is that, we got vaccine in the community right now, are vaccinating our highest risk people as quickly as possible. And of course, the weather is starting to break, which really could be the positive change that we need. Folks, it's so important that any gatherings you have occur outdoors. The number of close contacts per case, which we examine closely, continues to increase and is now in the range of 8 to 10. If you have more than 5 or 6 close contacts over the last week, then you could potentially be contributing to part of the problem we're seeing here. Please do not have indoor contact with people without wearing masks. It's the reason we are seeing a third wave taking off. And as much as the vaccinations are going to protect the most vulnerable from death, we still will see hundreds, if not thousands, of hospitalizations and ICU admissions across the province, which puts potentially an unmanageable burden on the healthcare system. On the vaccine front, we have opened up to people who are over 75 years of age today. We had a flood of activity to our website and to our phone lines, which we expected. There were some people that had difficulty getting through, but we were able to book several thousand vaccinations appointments this morning, and we continue to do so, hundreds per hour. There are still, as of midday today, about 6,000 appointments over the next 2 weeks available in the system. One of the issues that has come up is that the North London Optima Centre, which was the 6th clinic to open up, so we have 3 in Middlesex-London, as well as a number of clinics in the Southwestern Public Health that are all listed on the website. The North London Optima Centre is at the bottom of the list, and if people are checking for appointments, they may not notice it down there. So do check right down at the bottom, scroll to the bottom of the list of the clinics, click on North London Optima Centre. We do have appointments available there. And if you've had trouble getting through to get an appointment, please do try again. There are still appointments available over the next 2 weeks. Thanks, Dan. I'm happy to pass to Dr. Dukelow from LHSC.
Thank you very much, Dan, Mayor Holder, and Dr. Mackie. Appreciate the opportunity to join today's briefing and talk about COVID at London Health Sciences Centre. Over the past week, just like our community, we've seen a gradual increase in the number of COVID-19 inpatient cases, where we sit at 13 today. We are caring for less than five or fewer patients in our ICUs. The outbreak on the 4th floor of medicine that started just over a week ago is continuing on. The outbreak currently involves fewer than 5 patients, a total of 6 staff, and 0 deaths. We want to reassure our community that we are doing everything we can to contain and resolve this outbreak, including continuing enhanced outbreak and precaution measures. I do want to thank our staff and physicians at both UH and Victoria Hospital for their ongoing efforts to ensure that we still care for patients safely, despite the challenges that an outbreak brings. As we begin to see the numbers of those vaccinated in our community increase, it still remains critical that you continue to follow public health guidance to limit the spread of COVID-19. We know across the province, hospital numbers and ICU numbers are rising. To ensure safety of all those in our community, please limit your social interactions and physically distance, wash your hands, and wear a mask, as Dr. Mackie outlined. Lastly, our emergency departments are open and safe, and we ask that you do not delay seeking care in an emergency when needed. Thank you again for having me, and I look forward to your questions.
Thank you very much, Dr. Dukelow. Thank you, Dr. Mackie and Mayor Holder. Well, we do have quite a few questions, so let's get to those right away. The first one, Dr. Mackie, is for you. Comes to us from Nick Paparella at CTV News London. Dr. Mackie, are you concerned about people from London, Middlesex going to Kingsville to get their shots? If they do they have to return there for the second shot?
Yeah, thanks for the question, Nick. It has come up a fair bit, people shopping around different communities depending on where they might be able to get an appointment. I'm not concerned. We're a system. As long as people are getting vaccinated, I'm happy. The provincial tracking system means that we will know where people have gotten their shots before. And the automatic second appointments, which are generated when people get their first shot, will likely be at that same clinic. So it's likely that those people are getting appointments booked for that same location. But we should be able to change those. It will take a phone call, and the phone lines obviously, often take some time to get through, but we should be able to handle that. The system certainly will track it. Thanks, Nick.
Thank you very much, Dr. Mackie. The next question is also for you, Dr. Mackie. It's from Elan Peterson at the Western Gazette. Dr. Mackie, are there any new cases associated with the outbreak from student partying, or is that outbreak contained?
Yeah, we haven't seen new cases since we announced the 48 on Thursday. So at this point, it seems to be contained. We're not declaring it over yet. We want to see 2 incubation periods go by, but certainly not seeing new cases is a good thing. We're testing a number of contacts there.
Thank you very much. Jane Sims has the next question from the London Free Press. Dr. Mackie, new research out of the United States this morning points to a 79% vaccine efficacy for AstraZeneca, 80% for folks over 65, and 100% at preventing disease and hospitalizations. We're hearing examples of people driving to Windsor or Toronto to get shots at participating pharmacies. Now that the age band has been expanded to include anyone over the age of 60, do you know when AstraZeneca will be available in London and area pharmacies, which pharmacies will be on the list of vaccinators, and whether any family doctors will have the vaccine? Also, how significant is it that the province has expanded the vaccination age group?
Yeah, thanks for the questions, and it really is great news to see that new data on the Oxford AstraZeneca vaccine showing that it's very effective in the context of the US, and in particular, the data around the vaccine being effective for those over age 65 is very important. We encourage people to seek vaccination wherever they can. So if people have time and energy and they want to drive somewhere to get their vaccine where they may be eligible or may be able to find an appointment, we encourage them to do that. We certainly have seen people, lots of people from Southwestern Ontario and even from the Greater Toronto area coming here to get their vaccines at various points. No issues with that. You know, as long as they're taking precautions, keeping their distance, wearing masks, then I don't see any problem with that. Go where you can get a vaccine. All of the vaccines that are available right now in Canada are good and effective. On the question of pharmacies, we're not getting direct information. That information is flowing from the provincial government to the pharmacies. So local public health is aware that there is a pilot in some of the health units in Ontario. Beyond that, we don't know what the next steps will be, which pharmacies, or anything really about that process. On the question of expanding the vaccination age, I see what Jane's doing here. We used to break the questions up. Now she's asked them all in one. Very clever, Jane. You've hacked the system. On the question of expanding the age for the AstraZeneca group, that's great. It just means that, again, we can get more vaccine more quickly into the arms of the people that are most vulnerable in those older age groups. You know, many people are concerned about various types of risk factors that they're facing in their lives. We have a lot of data about this, and by far the most important risk factor, by about a factor of 5, is age over age 80. People over age 80 are way, way, way more at risk of death than anyone from any other risk category, whether it's very high risk disease or other age category. After that, second, and it's not even close, is people over age 70. If you're over age 70, you're roughly 7 or 8 times more likely to die of COVID than any other age group. And so, you know, when you look at some of the high risk diseases, for example, or even age over 60, age over 70 is 2 to 3 times more important of a risk factor than those other risk factors. So that's why it's so important to focus on age-based, and why expanding AstraZeneca, the Oxford vaccine, to people in those older age groups really helps the campaign to prevent as much death as possible.
Thank you very much, Dr. Mackie, and thank you, Jane, for, I was going to say that question, but I guess those questions. All right. Next up, a follow-up question from Elaine Peterson at the Western Gazette. And I think we may have actually spoken to this already. Were there any concerns or any charges laid in relation to St. Patrick's Day celebrations over the weekend? Mayor Holder?
Yeah, thanks. Let me make some reference. I know that we're talking about over the weekend, but let's be specific around St. Patrick's Day itself. Here's what we do know, that the bars and restaurants in London stayed within their capacity limits because of our requirements under the provincial restriction, and no charges were laid. What I can tell you is that police did respond to 48 noise complaints, and a number of warnings were issued in relation to the Liquor License Act and bylaw related infractions. I'd also add that 6 people suffered non-life-threatening injuries. And finally, just as a point, there are some possible reopening Ontario Act offences that are currently being investigated by police. So that's still a bit of a work in process right now as as of today, those charges have not been laid.
Thank you very much, Mr. Mayor. Dr. Mackie, the next question is for you. It's from Sophia Rodriguez from CBC London. Dr. Mackie, we hear that people ran into difficulties trying to book a vaccine appointment this morning. What happened? Have the issues been resolved? And what's the best way for people to book their appointment going forward?
Yeah, thanks for the question, Sophia. So, we really encourage people to become familiar with the website in advance. And I guess people took that message to heart. We had over 30,000 hits within the first half hour or so this morning. We did book several thousand appointments out of that, but the website did grind slowly when it had that level of volume. We were able to tweak the website so that it gave people a wait time. So if they weren't, blocked from entering the website because of the traffic, but instead they were sort of put in a waiting room. And that allowed people a bit more clarity as to when they would be able to book and help keep people in the system so they weren't getting frustrated. So, at this point, again, we booked several thousand appointments. There are still about 6,000 left in the system. The website is booking people. We've tested it, every hour we're looking at it, making sure that it is booking, and those bookings are definitely happening. So we're encouraging people, if they've had trouble, to go back, check out covidvaccinelm.ca and see if they can get another appointment.
Thank you, Dr. Mackie. The next question is a follow-up from Sophia Rodriguez, and it's about schools and allergies. Dr. Mackie, how will the health unit handle allergies with school-aged kids? With allergy season here, we've heard from parents who are worried that a runny nose could mean they need to have their kids tested for COVID-19. Will that be the case?
So this is a bit of a gray zone. If somebody has diagnosed allergies and they've had an exposure that would lead to a runny nose, it's not necessarily considered a factor for COVID. But that's also, something you've got to really be certain of. You don't want your child suffering from COVID, potentially spreading it to other children or spreading it to your family, just because you decided not to get them tested and thought it might have been allergies. And it's something where you set a pretty low bar. If there's any reason to get tested, we really encourage people to do so. The other thing is it will come back. If the person doesn't get tested and then spreads it to another child at school, they're going to be off getting quarantined anyways. So strongly encourage people, when there's any suspicion that anything could be going on, to go and get tested. The assessment centers right now are working well. Got some positive feedback from the assessment center at Carling Heights just over the weekend. So there are appointments available. Really encourage people to use them.
Thank you, Dr. Mackie. Megan Stacey has the next question. Megan is with the London Free Press. Dr. Mackie, after months without shutting down a school, we're now seeing several elementary schools in neighboring communities closed because of COVID-19. Is it the variants driving this change? And do we expect to see this happen here in London?
If you're interested in what's going on in schools and other communities, you'll have to ask the medical officers of health there. We haven't closed any here. Our numbers in schools are very small. We're even in the schools where there are outbreaks, we're talking about 2 or 3 students in the vast majority of cases, maybe 5 students, nothing that would justify a school closure. And again, that is with a lot of testing around those cases. All of the classroom classmates and anyone in close contact in a bus or after school program, those kids are all getting tested if they've been in contact with a case. And we just aren't seeing a lot of cases, even in those places where outbreaks have been declared because of 1 or 2 transmissions that possibly are linked to the school.
Thank you, Dr. Mackie. Andrew Graham from Global News Radio has the next question. Dr. Mackie, well, we just talked about St. Patrick's Day before, and that's what Andrew's question was about. So
I think the key question here is whether we have seen any cases associated with St. Patrick's Day. And you're right, Andrew, it would be too early. You usually aren't getting symptoms until 5 to 7 days after exposure, then the people, so that could be now, sure. Then people have to go down and get tested and we get the test result back. So all of that takes a few more days. So we wouldn't see St. Patrick's cases in the numbers yet.
Thank you very much. Jane Sims is back with a follow-up question, Dr. Mackie. Jane says, I'm a little surprised to hear there are 6,000 appointments available. Can you be specific about how many appointments were filled today and, given the anticipated demand, why so many are still open? You're just on mute.
We can't be specific at this point, Jane. We don't have an exact number of how many. It is evolving. We're booking literally hundreds of appointments each hour. And why so many are still open, we need to get people in the book. So we're continuing to work on that. We're also working on trying to get a specific number of bookings today. And Jane, if we get that number, we'll follow up with you.
Thank you very much. Andrew Graham has another question. Dr. Mackie, as London enjoyed beautiful spring weather over the weekend, there appeared to be a visible increase in foot traffic downtown. Is this something the health unit has observed? And if so, does it cause any concern?
Well, in the sense that I'd rather see foot traffic downtown than people gathering in their homes. It potentially could be a good thing. We don't want to see large numbers of people gathering in the homes. If they're going into businesses and respecting, masking and distancing rules, using the hand sanitizer, minimizing close physical contact less than 2 meters, then it's something that is, pretty reasonable and I would say a calculated risk. If they're going, to a friend's house for a party, that's totally different. And if they're not taking precautions indoors, that's where we really see the risks. So, it's not a bad thing to see people outside in the good weather, as long as that doesn't mean that they're gathering indoors as well.
Thank you, Dr. Mackie. And a quick reminder that if you are a member of the media participating in today's briefing and you have a question and you've been waiting to ask that question, now would be the time to submit it before we wrap up, as we only have one more question in the queue for this afternoon. And this one comes from McKinley at the Middlesex banner. Dr. Mackie, how many vaccinations are taking place at the Mount Bridges facility per day at this point, maximum capacity, so to speak? Any news on additional facilities or plans for facilities in the county?
Yeah, so McKinley, none of our facilities are running at capacity. Each of the 3 clinics we operate and in partnership with LHSC are running between 35 and 65% capacity. And that's because we have, about twice as much capacity as we need to use all the vaccine that's being sent here. So the Mount Bridges clinic in particular has capacity for 550. We're currently booking about 350 in that, just because, again, the vaccines are not there.
Thank you, Dr. Mackie. Skylar McCarthy from 106.9 FM, The X at Fanshawe College is next. Dr. Mackie, with the rally that we saw on the weekend, could this be a sign of concern considering the 7-day average is climbing up?
So, one thing that I found encouraging was that we have seen much larger rallies. So, I know there were hundreds of people there. That's, less than you've seen in some of the Aylmer rallies, for example. I certainly, and the other thing that was notable about their rally is you had so many people complaining about lockdowns. We are not in a lockdown in this community. Only one of our neighboring health units is in a lockdown or anything close to that. The irony of these protests, when you're gathering hundreds of people without masks for significant periods of time in close contact, and you see from the pictures they were close, that potentially could lead to another lockdown in this community. So, these anti-mask rallies are claiming to be about one thing, but they're actually potentially increasing risk of lockdown and achieving potentially the exact opposite of what they intend. So very disappointing to see people acting that way. We live in a community and a society, like all societies, that relies on people being kind to each other, doing things to take care of each other. And so anytime you see people saying, I don't really want to take any measures that are going to protect the people around me, I find that very concerning.
Thank you, Dr. Mackie. And I know, Mayor Holder, you spoke about this in your opening remarks, and I wondered if we could get your thoughts on this question as well.
Well, thank you, Dan, and thank you, Skylar. Look, there's an irony here that the people who came to London, Ontario to protest lockdown obviously have no clue what that means, because we are not in lockdown. Those are part of my earlier comments. And the difference between this and might I even say, back at Victoria Park when we had 10,000 people at Victoria Park for the Black Lives Matter, they were wearing masks, they were physically distancing, they were trying to be as careful as they could be under the circumstances of a massive crowd. These people were not. These people ignorantly chose to stand cheek to jowl, and as Dr. Mackie's indicated, this smaller 200 group can do more damage to London, and many of these people are not even from our city. But whether you're from our city or not from our city, you can do more damage, set us back even further, and hurt the very businesses you pretend to support and represent. And I say shame on them for making that as a decision that they would do and have that impact on our city. I said before, you can't fix stupid, and this is exactly what one of these situations is.
Thank you, Mr. Mayor. Final question this afternoon, and it's from Megan Stacey at the London Free Press. Dr. Mackie, how close is the 4th vaccination center to coming online? And is the decision about bringing it online based on vaccine supply?
Yeah, the 4th vaccination center was scheduled to be opened the 29th of March, and unfortunately we pushed that back indefinitely because of supply. We don't have the supply for a 4th vaccination center. If we did, it would be open before the end of the month.
Thank you, Dr. Mackie. And that does bring us to the end of our questions this afternoon. And a big thank you also to Mayor Ed Holder and Dr. Adam Dukelow for your time and your insights and your comments this afternoon. That does it for us for today. We will be back with our next virtual media briefing on Thursday afternoon at 2 o'clock. And we'll see you then. Take care. Have a great rest of your day. Thank you.